Theme 2, Communication and Language Assistance, offers recommendations for addressing language and other communication barriers.
We have to be able to understand their culture and their background and be able to communicate effectively if we're going to be able to help.
To communicate with a diverse population, you need to understand and appreciate that everyone is unique.
When we say cultural diversity, to me that means a lot of things. It's educational diversity, socioeconomic diversity, racial, ethnic, national origin diversity, geographic diversity.
It's important to remember that every family has their own culture and the way that they like to do things, their own family values.
You need to inform your clients that you have services available to make communication easy.
En la forma de que cuando llegamos siempre nos preguntan, nos reciben con una sonrisa y un amable saludo y nos preguntan qué es lo que necesitamos, en qué nos pueden ayudar y nosotros ya comentamos con ellas.
A great place to introduce your patients to the language services you offer is at initial points of contact, such as the front desk, registration, and waiting areas. Your signage and other information should reflect the specific language diversity of your client base.
We have signage in different languages, we have educational materials in different languages, we have staff who are bilingual and bicultural. If they understand the policies and their rights and their responsibilities, we have less program violation and it just makes everything run smoother.
Now you have more people out there that know the rules, the regulations, they know what they need to do.
Many people have no experience with medical language and terminology. That's why it's important your materials are written at the appropriate health literacy level of the intended audience. It's best to avoid overly complicated jargon or technical terminology that may be confusing or unfamiliar.
There are a lot of people who speak English fairly well, but when it comes to understanding a complex issue or a situation, if you can explain it to them in their native language, for some reason their comprehension level just goes up.
Here's an example of language that's too complicated.
You're experiencing vasomotor symptoms and atrophic changes. I'll run some laboratory tests such as an FSH, LH, DHEA, estrogen and progesterone to determine if you meet the criteria for hormone replacement therapy.
Here's an example that's written more simply and clearly.
Diane, it sounds like you're having hot flashes, night sweats, and other problems that resemble menopause. Let's run some tests to see if medications would help treat your problem.
Any treatment for TB?
واحد دوينا أو TB ده حاجة مقالة من اللي سين حاجة مياه. No.
Efficient use of interpreters is a key element to providing quality services.
We know that it's a cost of providing good medical care. We build it into our budget.
Even though it will take some planning to schedule an interpreter at the exact moment you may need one, it's never appropriate to use family members, especially children, because of the opportunities for misunderstandings.
It's hard when you have family members. Family members can't be objective about the situation. They often include their own interpretation of events. They also don't know medical language, so you could have a medication error.
Those that can act as a healthcare interpreter include on-staff interpreters, trained bilingual staff, contract interpreters, trained volunteers, and telephone interpreters.
We've made phones available at all of our sites that are mobile so they can follow the patient from the front desk to the lab to the exam room, so the interpreter is with them throughout the visit.
Your voicemail and phone trees can be set up with multilingual options and notification technology.
You can use their own mother's tongue language to remind them. I think their primary care visit will really improve.
In the rush to see everyone, don't forget to be patient, respectful, and listen to your patient.
Everybody has to develop the skill as much as possible of being a good listener. If doctors, for example, are going to have positive and strong relationship with their patients, they can't just treat the disease. They've got to get to know the patient. They have to spend some time and talk with them and figure out as much as they can.
Effective healthcare communication means a greater chance for compliance, happier patients, and clients who are having better health outcomes.
If a provider can just take 1 or 2 extra minutes with a patient, listen to what they have to say, make sure they really understand what you've explained, that little extra time creates a sense of trust in your provider so that the patient is more likely to give you a little bit extra information that can help you as a provider improve the quality of care, not just for that patient, but for the other patients that you're seeing.
If a client can come and get the services that they need, then they're going to come back and they're going to be able to tell their friends, and that builds our clientele, so it works both for us and for the client.